Hey everyone, this is Paul from Ortho Eval, and today what I want to do in this video is give you a demonstration of some of the exercises that I like to have my patients do if they have a proximal hamstring injury. We have our patient here, Michael, who injured his proximal hamstring about 3 weeks ago when he was trying to take a boot off, and when he did, injured that proximal hamstring. Now, what we want to make sure that we do is not push this too hard. We also want to make sure that we've ruled out things like an avulsion of the ischial tuberosity or a complete tear of that hamstring. So if there's a lot of bruising, a lot of swelling, can't sit on that area, you can't go up and down stairs, you really need to see a medical provider and get this checked out. But if it's just a little general discomfort, like at this point, he's been having a lot of stiffness, especially after he gets up out of a chair. Still a little bit stiff in the first quarter mile to half mile of running on a treadmill. So we want to try to improve his mobility and start to build that strength up again so we can put a little load on that tendon and have it function a little bit better. So first exercise I want to start with is just a gentle hamstring stretch. You can use a belt or a towel. I prefer not to use a rubber band with this one. I like it to be nice and tight. So what you do is you put this around the arch of the foot, keep the leg straight, and you just gently pull up in this direction till you feel a nice stretch in that hamstring muscle. Keeping the knee straight will get a much better stretch because the hamstring is a two-joint muscle. And I like to hold these for about 30 seconds. And we're doing 5 of these, okay, with a little 15 to 20 second rest in between. All right, so that is our hamstring stretch. It's a great way to get started. Nothing wrong with doing this. Now we're going to come down, and I want to show you the sciatic nerve flossing. Now the reason we want to do this is because if he has a small tear or a lot of inflammation and swelling and develops some scar tissue next to that sciatic nerve is not going to slide and glide very well and could cause some neural tension, which could look like a herniated disc or a piriformis type syndrome, which will give him pain down the leg. So the way we do this is clasp the hands behind the knee. We let the leg rest like this and pull the foot up toward the knee. Now what you do is you straighten out the leg while the foot is still being pulled that way. And then you go till you feel quite a bit of tension in the leg. From there, we back off a little bit. Now we keep this bone in this position and we pump the foot all the way up, all the way down 5 times. Okay? I'll do this on the other side also so that this leg gets a little bit of a rest. And I'll do 4 to 5 sets on each side, just like that. Then we come back down and rest. Take a little break, okay? Now the next exercise I like to do is a double-legged bridge. This is a nice little progression. We are making that hamstring work a little bit, but we're getting a little help from the other leg, and we're bending at the knee. So all we are simply doing here is keeping both feet on the table, and then picking the bottom right up, and then back down. So simply up and down like that. I like to do sets of 10 to 15 repetitions, 3 sets, and if that feels okay, then we just kind of work through that. If he has difficulty getting to a certain range, then what we'll do is we'll modify that and not go so high, okay? The next exercise I like to do becomes a little bit more advanced. So what you're going to do now is you're going to pick your bottom up off the table. This is going to be a one-legged isometric. And now you're going to lift that one off the table and you're going to hold yourself there. You can put your hands on the table for balance. And we like to hold this. I like to start at about 30 seconds or so and then take a break and then switch over to the other side. Any pain with that?
Nope.
Okay, so what we're doing is we're getting a little load, an isometric load. This could actually be pain relieving for some folks after you finish the exercise. So I just tell people, you know, it shouldn't be much more than a 2 to a 4 on a pain scale while doing the activity. And the muscle's not going through a lot of motion, but just holding isometrically. Then you would switch sides and then do the other side, okay? And that would be your isometric one-legged bridge and can be beneficial. I like to do 5 at 30 seconds to start with, but ultimately our goal is to get to about 45-second holds on each leg. And then if you can do that, you can add a little plate on the stomach and, 10, 15, 20 pounds and do it for 45 seconds times 5. Now our next exercise is just going to be a standing lunge, which is going to activate and stretch a little that hamstring a bit, but also get it to work some. So what you're going to do is you're going to put a hand on the table, Okay, this leg is going to be ahead, and you're going to go down and back up. Now, we're using the leg in the front to let it down and to go back up. Good. Back stays nice and straight, and it's nice and controlled. So we're just getting some activation of that hamstring. The other thing that we could do after this gets better is to work into a walking lunge and then start to work on holding on some dumbbells while doing that walking lunge. Now going from here, we could progress into an RDL, okay, with the feet equally apart. We're going to imagine we're holding onto a bar here, keeping the abs nice and tight, back is straight, and you're going to be bending forward with just a gentle bend in the knees, and now you're going to bring the back up again and lock out, and then back down, bending, and then back up. Don't bend the knees so much. Good. You feel that back here? Mm-hmm. Okay. And back up. And so we would progress from there to adding some weight to this. And then from here, we could get into a one-legged RDL, and I'm going to demonstrate that myself. I'm going to have you here just because he actually has a hamstring injury where you would have the weight bend the knee a little bit and come down, feeling that pull here, working on some balance, and then coming back up. Then you can slowly increase that weight. Now, once you have, you can sit right down, once you have been able to achieve some of these exercises, you definitely can get into higher speed activities, back to running, jumping, cutting, as long as there's no pain back there. But the exercises we gave you today are just there to help you get started after you've had a mild to moderate hamstring strain back there. So I hope you enjoyed today's video, and if you did, give us a thumbs up and be sure to subscribe. Thanks.